The drums of HIV and AIDS sounded way back when I was still a young girl. And find that as Lira City, it is alarming that we are at 12%. Actually, in the monitor which appeared, I looked at it and I said, wow, other cities are not there, but why Lira City? And we are at 12%. It is alarming. That means in every household, HIV has walked there on foot. And this is true. We saw that the female gender is the one which is highly infected. This is true. There's no doubt about that. Because only one insect can pollinate several flowers. Yes. From one man, 10 women can be infected in 2 days. This gym and massage parlors for sure. Where the world is going, you don't understand. There is open nakedness in these gyms and massage parlors, and yet it is intergenerational when we enter there. Old women with their body shapes, the stomach is there, the bum is there, and the breasts are all over the place. They are also in small sukas, walking naked. Before young boys, then the old men also come with their big tummies and their big ring pin in the head. Small legs, they are all naked there. Without shame. And the devil will help you to focus in those areas of the genitalia. The men will be focusing on the yacht, the ladies will be focusing on the engine. To see if the magazine is actually working.
What has been very silent, we have not been focusing on this. But the more people drink, the more your judgment is impaired. As they say, it goes when you take one bottle, the lady is still very ugly. 2, 3 bottles, it becomes very beautiful. Even the queen, you begin appreciating and all that. So alcohol is one of the key drivers which we need to focus on and address it vigorously. Then another key driver, which was hidden and silent, is depression. The majority of the population are depressed. The only way they can seek livelihood, go for sex, go and, they say, make fun. So in the course of fun, they end up. Then most notably, you know, as development goes on, they come with the beauty and the disadvantage as well. Massage parlors has also turned out to become serious hotspots. So, what goes on inside there is alarming. So you can see the overall situation. And all those other ones that we have been singing, have been telling you about this and all that.
HIV issues we academics and students have been investigating within Lira. I just want to supplement what the HIV person has said. One of the key population causing spread of HIV within Lira are people living with HIV themselves. And we have been researching on these people who are living with HIV. How are they trying to prevent transmission of HIV to their partners or even the people they live with. So one thing I must say is that we research on women, young women, adolescent girls and young women living with HIV/AIDS within Lira. And we found that this population have very high rate of unprotected sexual intercourse, to a percentage of 78.5%. 78.5% of adolescent girls and young women within Lira who are living with HIV/AIDS and who know they are living with HIV/AIDS, who are receiving treatment for HIV/AIDS, are engaging in unprotected sexual intercourse. And even we found that these girls have high rate of unintended pregnancy, starting at 33.7%. They got pregnant, either it was this time or they did not want it at all. And by even getting pregnant, it means they engaged in what? Unprotected sexual intercourse.
The young people are they sexually active. And the older men like us are again going for younger ladies. Hillary mentioned something here. I noticed it myself. In most of the saloons and also these other places where people gyms, you find they have employed very young girls, very young beautiful girls. Huh? And these are the ones who are always there. They want to massage you, they tie you up. Actually, recently when I got to one of those places, I just told them, you just save my hair. Because I didn't want to go into those temptations. Huh? Because we are married, and some moments you have your wife, sometimes he may not be able to touch you, your head, and be able to massage you like that. Why should another woman do that and then you? Huh? Okay, it is also part of health, but somehow, in comparatively, we find it, enjoy it after. So if you are now interested in this one who have massaged you and you have enjoyed the soft, because for them they don't do hard work, their hands are very soft and very, very encouraging. You find they provoke your, because we're human beings, they provoke your sexual feelings. And then you find at the end of the day, what Hillary had mentioned, that even if she was a ugly girl, she now begin to become look so beautiful and so attractive, where at the end of the day, you end up going, and then you mostly have heard words where people refer to persons living with HIV like victims. I'm not afraid to tell you, pressmen, that that is not a very kind word. I'm not a victim because I did not look for it. But somehow, somewhere, I got myself there. So, those words also, let's be mindful. Victims. Because if you refer to, I don't know what the dictionary word of victim would mean. I will not want to go into that because Professor is here, they understand it better. When we are to analyze that word victim. So, the treatment is helping so much. And once somebody is, the virus is undetectable, then that person may not be able to infect another person. And the good thing is that those who are virally suppressed are people who are living very positively, and even their sexual life is not so much into getting new partners. It is these non-suppressed people who are always, because of the money or what, they end up infecting other people. Remember, taking HIV medicines does not prevent transmission of other sexual transmitted infections.
Because the national strategy is that if we do adhere to the set standards, then eventually we should be able to contribute towards the end of this scourge or the spread of this disease in this country. So I ask my friends in the media fraternity that we need to constantly communicate this message. that allows the people who are found to be HIV positive to respond to the various supportive treatment that is necessary, in addition to passing the preventive messages. What message can we then send that can bring in the mind of our people that it is dangerous to get HIV/AIDS? So much that the joke that we now hear is that our girls fear pregnancy more than HIV/AIDS. It's a worry if they say I'll get pregnant, but it is no longer a threat if you say you're going to get HIV/AIDS. So how do we bring back that message? I'll make this in a broader sense, but I know HIV/AIDS also falls in that perspective. Why it's important that we address this issue, friends, is that nationally it is so scary to imagine that as Uganda we cannot afford the cost of our own health needs. When you are crying, oh, there is no medicine in the hospitals, there is no this in the medical facilities, can I remind you that 70% of what we are asking of in our medical facilities is funded by somebody else who is not a Ugandan, called a donor. Now, it is the donors who are making us live to see another day, accordingly. So that is so scary. When shall we take charge of our own country? Just imagine you are sick, and somebody in America is the one supposed to plan for your treatment. Isn't that so scary? So this and that we can prevent. We should collectively do everything it takes to remove the burden away from our health facilities by communicating and speaking to ourselves and reducing it to an extent that we don't need any donor to support it. Otherwise, if we don't, then we shall forever be yoked to the donor world on every issue.
In Lamu region, what is it that is happening? How we plan to work, of course, to do in collaboration with the Ministry of Health and the district leadership. There's a lot we are doing to ensure that we reduce the number of new infections within this region to at least 90%. So we want to have 90% reduction in the number of new HIV infections by 2030. But in order to do that, there is a component of averting new HIV infection up to around 34,000. Because these are the total infections we have reported for the last 4 years within Lamu region. So if we are to continue at that rate of identifying new positive, it means we need to scale up our implementation, get as many as the 34,000 who are still out there in the community, link them to ART, so that they can actually contribute to the overall prevention of the spread of this disease. The strategies we have done, you heard from the speaker earlier, there's a lot of emphasis on, of course, the ABCs, but also the main. And looking at the safer sex practices, the ABC still stands, and our contribution towards that is one of the things that we have highlighted there, that in line with the ABC strategies, as a region, we have been able to support the installation of up to 10,000 condom dispensers across the region. 2, we have over 40,000 IS materials on condom use distributed across the region, integrated the condom use messaging in all our community activities, and we have continuously engaged with the district leadership to be able to use the radio platforms, the media houses, in order to be able to disseminate this information, because interventions at the community alone is not adequate. We need it to be backed up by other forms of community sensitization through the media houses. And this is something we have closely worked on with the district leadership. And I'm happy to say that they have been very positive to be able to share their radio airtime with some of the technical people, including messages on HIV prevention as well as the condom use. Then the issues around the security and commodity security for condoms has been worked on, worked closely with the national warehouses. I think as a region we've not had major challenges when it comes to the stock of condoms. But of course we also see that even when the condoms are there, utilization is another thing. So this is something that we continuously work on and engage the various stakeholders to have this improved. So in terms of testing over the years, you can see that our HIV status, we see more females. If you look at, is this okay?